All right. Everyone, so my name is Dr. Logan Shield. I'm here with Danny. Came in with some severe lower back pathologies. I believe it's some disc herniations down in the lumbar spine with scarring in his hamstrings. This man's a Marine Corps veteran. You know, he's got injured a couple of years back, and basically what we're doing today is correcting or starting to mitigate some of the scarring he has along his hamstrings over here. So I employed the use of some cupping. Basically, the darker circles indicate areas where you have the most damage, and it's actually indicative of scar tissue between two muscles, the biceps femoris and the semimembranosus, right between that fascial lining right there from an old tear. Lower back is herniated. Of course, I performed some grafts and scraping just to get some better circulation in this area, start to perform manual therapy on the musculature, because it's going to be a journey with reversing a lot of these conditions. How you feeling so far, man?
Fantastic.
Right, so we're going to continue on with the hamstrings here. Hope you're ready. Here we go. So, especially with hamstrings as muscular disease, I like to use my elbow, and they're especially pointy. Maybe when I was born for this kind of work, because really get into the muscle there.
Oh boy.
Good. One more time, and move on in. Here we go. A little bit deeper, all right?
Yep.
Take a deep breath.
Yep.
And more force. Here we go. It's starting to break up in there. It's not as tight as they feel.
Mm-hmm.
It's less hypertonic. So hypertonia is a term, that we use in anything in sports medicine that indicates tight muscles. So hypertonia comes from the word. Sorry. Wait, let me get this part done here. 3, 2, 1. Okay. So it's an offshoot of the word fixotropy. Fixotropy indicates anything that's fluid-based and how hard it is. So you have this special fluid where if you punch it, it hardens, but then if you dip your hand in it, it becomes soft again. So reducing fixotropy with the soft tissues, making them less hypertonic, would require good old manual therapy. It's something that a lot of chiropractic doesn't directly work on, but I do because I like working on the soft tissues. I believe you can't work on the skeleton or any of its structures without working on the soft tissues first. So, up, 2. There we go. And sometimes with issues with the hamstrings can begin to affect areas in your kneecaps, because all of the insertions for the muscles in the hamstrings fall laterally on both sides of the knee. So if you have tightness in the hamstrings or any restrictions up here, it'll start to affect the kneecap, and it'll bring these two structures closer together. So it'll bring the tibia, the fibula, closer to the femur, the condyles of the femur, and create points of pressure with a lot of the ligaments and tendons that end up either inserting into the knee capsule or falling along the line into the tibia and fibula. So definitely important to keep these structures nice and pliable.
Funny you mentioned that too.
Yeah, sorry. I'll give you a second to talk. 3, 2, 1. Good. There we go.
I was trying to say, I also have like a hole in my left shin. I don't know, not
Really?
per se on the bone, but like there's like a muscle area. If you put your finger to it,
Yeah.
you can fit like a good tip of your finger in the
Really?
hole of my shin. And I don't, maybe it could be related to all the tightness starting from the top. But
Interesting.
if you go down a little lower, you'll feel a big indentation.
Oh yeah, there it is. Interesting. And this has always been that way, or this?
It's after I got the injury on the point of.
Oh. Yeah, so that definitely damaged the muscle tissue here. You got some scarring going on there too. It's like it's a piece of clay. You just like kind of
Yeah, you feel it, right? Yeah.
Yeah. Well, this is something that we can try to mitigate as well, because that definitely has a lot to do with the tightness up there. We bring your leg down. I'm gonna give this part a break for now.
Gotcha.
Now let's see about this lower back. Man.
Oh my God.
The fibrosis down here starting to break up a little bit. There we go. Felt that?
Yeah. Oh yeah.
Man.
Oh God.
I'm gonna have you fixed up in no time.
Yes. Yes, sir.
Alright, here we go. You ready?
Yep.
Brace yourself, and here we go. Three, two, one. Good. Man. Gonna give you a quick break.
Oh my God. Where am I?
Alright, you're still alive. I'm gonna do that one more time on each side.
Yep.
And then I'm gonna start my adjustments, alright?
Oh my Lord. One more time with that?
Yeah, one more time. But not just once going over.
Do your thing, Doc.
Yeah.
Doc, do your thing, man.
Thank you. Thank you.
Road to recovery.
Yeah, fortunately, what I'm feeling in here, like I said, this is a lot of fibrosis.
That feels sore already to the touch.
And nice, what I'm feeling here, so lordosis is essentially a spinal curve.
Yeah.
Loss of, or
Yeah.
excessive lordosis when you have too much of a curve.
Yeah.
So this shouldn't be this curve right down here. You
Okay.
got to work on your quadratus muscles, then your multifidus lumborum muscles, which I say that they're the brother or sister muscles to the quadratus,
Yeah.
but they line, excuse my fingers here, they line the sacrum, all those deep structures,
Yeah.
and it's like a skinny set of muscles that insert also into your pelvic crests,
Mhm.
or ilium, right over here. So
The SI joint.
that's right.
Mhm.
So, and then they basically line the spine and insert into all the lumbar vertebrae there. So, very important to keep those muscles nice and pliable and strong. Are you ready?
Yep.
There we go. All right. 3, 2, 1.
Oh, actually, it hurt last time.
Good. Here we go. One time. And brace yourself. In 3, 2, 1. And almost there. Almost there. Almost there. Good. Good job.
Oh my God. Oh my God.
That's funny.
Best doctor I've been to so far. Hands down.
I appreciate that, man. Thank you.
Hands down.
As I can tell everyone, man, if you're going to get your body fixed up, basically chiropractic, physical therapy, physiatry, all of these others, massage therapy, it's basically body work, man. So you got to do what's necessary.
My
to heal
toes
people.
are tingling. Oh, God.
Good. Now with this workout, I also tell everyone, the next day, definitely going to be sore. You may even feel like there's a regression. It's nothing but progression. So with the fitness plan I built for you, the diet plan, it's going to be built off of 8 weeks. All right.
Okay.
The first workout we do will be together so I can set the pace for you.
Gotcha.
And then you're going to pick up after that. All right. So we'll probably do it at like Wing Fitness or whatever's convenient. So.
Mhm.
Do you have a gym membership? Not yet?
I actually work out at work.
Oh, okay.
Yeah, I
All
work
right.
out at work.
Oh, you have a gym in
Mhm.
Okay. All right.
Yep.
I'll talk more about that later.
Mhm.
Take this off here, right here. Cool. Thank you.
Yep.
Now for this adjustment, I gotta climb over you, so excuse the contact.
Sure.
All right?
Sure.
I'm not trying to come on you or anything.
Okay.
All right.
Okay.
See that. Let me bring that in. Cool. All right. Now, you gotta climb over here. Put your fingers right behind up there. All right. Now take one deep breath and breathe out. Good. And oh. All right. Where'd you feel that? Good job.
Oh. Literally all up there.
All right, good.
All
good.
up there.
What I want you to do now is lay on your back, all right? When you're ready, take your time.
Oh my God.
Yeah, this way.
Yeah. Oh, it smokes, man. Oh.
All right, now, and then you lay your feet out.
Sure.
Right there. Now, don't get scared. I got to strap them in.
Gotcha.
Because I'm going to do a reverse decompression or distraction of your cervical spine down to the
Okay.
lumbar. So I'm basically pulling. Right?
Gotcha.
Same thing I did to your sisters.
Gotcha.
She should like that. Let me see your hands for 1 second. Right. There we go. I'm going to put it down. There we go. Cool. And you put me on my stomach.
Good.
Now, when I wrap this towel around you, I don't use the Y strap. So this is typically what chiropractors tend to use. It's this bad boy right here. But I don't use this because it brings me further away from the body. So I use the top.
Gotcha.
Right. But to me, it's just chiropractic property.
Gotcha.
Alright, lift your head up. And back down. And now, take a deep breath through your stomach. And breathe out. Stay nice and relaxed here. And you're gonna put me lift you up, so try not to tense up. I got you, man. And here we go. Lift up a little bit more. 3, 2, 1.
Oh.
Good.
Oh.
Very good. How far did you feel that travel down?
Oh shit. Oh, excuse me.
Good job. No, you're funny, man. Express yourself. This is an expression-free zone.
I felt it like, I'm feeling it, I gotta say like mid to back to where like my shoulder blades
The
are.
shoulder blades? Okay, good. Perfect.
Oh my God.
Awesome, man. Now I'm going to adjust the cervical spine. Right?
Okay.
Oh, yeah, no, take your time. You're good.
Okay.
Yeah, you're good. You're good.
Oh my God.
Come back to your feet real quick.
Gotcha.
Cover up there.
That was my bad ankle.
Bad ankle.
Yeah.
Yeah. Next session, I'm going to get to work on that. So you see, with a frame like yours, you got these long legs, all right?
Yeah.
But then, fortunately, you have an equally long torso. So, with your body, you know, your lower back area, but basically, you know, you're built to have a very strong lower back, so that's something, you know, be easier to work on.
Gotcha.
So a person like me, I have long legs, but a shorter torso, so my lower back is much more prone to injuries. So,
Gotcha. Gotcha.
Here we go. Now, unlike other chiros, I don't rotate with the neck, I just push with the vertebrae.
Gotcha.
So, what I'm going to do is bring it to the side, up, and I'm going to push. Good. There. Good. I'm going to come up, and there we go.
Oh.
Cool. There we go. Awesome.
Oh my God. I feel everything like.
Good. That's the redistribution of cerebral spinal fluid. So when you have areas of compression, that fluid stops flowing, and that's the fluid that lubricates the brain. So
Okay.
sometimes we tend to feel sluggish. We got to keep things nice and line to prevent that.
Gotcha.
Sounds just like this. Now I'm gonna lift
Like
up
this?
myself. Nope, just like this. Yeah. All right. So and you stay nice and limp. I got you. And all right, here we go. Take one deep breath and breathe out. Take one deep breath. Take one more deep breath. Perfect. Good. Now I'm gonna bring this thing right there. Now lay on your side and face me this way.
Gotcha.
Alright. Good job. Now I'm gonna bring this like up.
So we got a whole new body.
Actually scooch over towards me just a little bit more. There we go. Bottom leg straight, right?
Yep.
That's perfect. Alright. I'm gonna turn you off to the side. one deep breath. And breathe out. Oh. One more time. And breathe out. Oh. All right, cool. Other side when you're ready.
Gotcha.
Okay, thank you. One more deep breath.
Yep. Wow, it went without me.
Yeah, right. Good. Now, what I want you to do is
Yep.
sit up and face this way.
Gotcha.
We're gonna sit right behind you.
Gotcha.
Now bring your legs out to the sides. Good.
Gotcha.
Bring this towel over you. Come underneath your arms here. Put your hands right on top of mine. Now I'm gonna lean you back. Climb over here. Take one deep breath. And breathe out. Oh, good. Perfect. And now, I want you to just
Holy sh!
cross your arms
Like
like
that?
this.
Yep.
Yeah. All right, gonna come a little close. Excuse me.
Yep.
All right, I'm gonna turn this way. Take one deep breath. And breathe out. Good. Check this side. One more deep breath. And breathe out. Oh. Good. Now, stand up right over here. We're almost done, man. Perfect. Now, put your fingers right behind your neck.
Like this?
Yep. And we're gonna bring our legs together. Push your head down. Right there. Take one deep breath. And breathe out. Oh. Good. Arms down. Perfect. Good. All right, man. How you feeling?
Like a brand new.
Good job. Yeah, but basically, I think there's a bulging disc down there. Confirmed with the MRI, but overall, just a lot of muscular imbalances we're gonna correct. All right.
Gotcha. Yeah, no, thank you, Doc. Appreciate
Yeah,
you.
you're welcome, man.
Appreciate you always.